Greetings. Thank you everyone for finding time to join us today. I'm going to say what the president, public policy makers, everyday people have been saying, it has been a year. But while there is light at the end of the tunnel, we have felt this very acutely. And thanks to the remarkable Edelman research team, Richard and I are prepared to talk about not only what has happened and the impact of what's happened, but what's next. And we are fortunate again to have Dr. Nabarro, who has been on this journey with us the entire time, with us today to reflect on what we are going to share and to give us his perspective on, again, what is next. Richard, over to you, and just again, a real recognition that we have been able to advise our clients. We've been able to work with our colleagues, advise and work in our communities because of this research that we have done throughout the year, and incredibly grateful and happy to have it again because it gives us the data that we need to make the decisions in the council and to provide to our clients that they expect. Richard, you.
Okay, so Dr. David and I have done this half a dozen times now, and we thought it was particularly important because of the decision by the governor of Texas about 10 days ago to open up the state. And we thought that it would put business into a difficult position of having to make choices. And so Target, Walmart, and others said, you want to come into our stores, you're going to have to wear a mask. And Starbucks and others have said, and all our people are going to wear masks serving you in the stores, because we believe that's the responsible way to play the game, because we're not sufficiently inoculated. So in any case, we went out, next slide, please, to the general population over last weekend. You'll see that we have a quite comprehensive group of, both geographically as well as by gender, ethnicity, et cetera. And so we're excited to give you this data today. Next. So you'll recall last we spoke that as of the end of December, business was the most trusted institution. Government had fallen substantially to be the lowest trust institution, and that media was frankly suffering deeply. NGOs were less relevant than before. So from a peak in spring, May 2020, at the most acute moment in the crisis, we had a peak of trust in institutions. And in fact, globally, government was in the lead. And in the United States, you see that NGOs and business were trusted equally. So as in all of these, things change quickly. Next slide. So we want to discuss today what we position as the American trauma. And we want to start out with the degree of trauma. We have lost 530,000 people to this disease. Virus concerns remain high. Let us not imagine that progress equals fears evaporating. It is not so. We are deeply scared still of the virus. Next. Here's why. More than half the people we surveyed said that they know someone who has contracted COVID, who either has been hospitalized or has died. And that's heavy. And it's also partly a function of economics. 1/3 of the people we studied said that they had had job loss or significant cut in income. And that's particularly acute among the 18 to 34s, also higher index for Hispanic and for Black, and women as well. Next. The majority of Americans are still in what we describe as pandemic survival mode. I am worried about my safety. I actually think that I am in danger. Now, this is different between a Biden voter, 80%, and a Trump voter, slightly under 50%. It's higher for those my age, 55 plus, than for 18 to 34s. But in short, it's still high across the board. We are still in a fetal position. Next. Here's the consequence. We're not ready to come back to normal. Only 15% of people say that they're prepared to use buses or subways or trains, 20% to fly on commercial airlines. Only 25% say they want to go visit grandma. 25% sending kids to school. What are we prepared to do? Only 50% of us are prepared to shop in stores or even go to the doctors. In short, we are still scared. We are looking over our shoulder every day. And if we have a cough or a sneeze, we're still wondering whether it's actually COVID. Next. Here's the story about trust in institutions. We have low trust in our institutions. Next. Here's the deal. Business, government, media, and NGOs have all had ebbing trust even since December, particularly acute for government, also for media and NGOs. Who is trusted? My employer. You'll recall in January, I talked about the phenomenon of trust having moved from the Moses model top down to 10 years ago, peer to peer. Now trust is local. Trust is local in my employer. It's a significant responsibility for all the companies on this call. Talk to your employees, talk to your customers, talk also to your communities. You know that you have a special responsibility when government is distrusted. Who's gone down in this most recent period? Well, in a year period, we've seen a substantial decline in national health authorities because FDA and CDC are seen as having been affected by politics. Also in global health authorities, the WHO trust has gone down massively since last May. Pharma business has had a big bump, but note that it is down from the peak in May. It looks like an A-frame house a bit. It continued to be higher than before a year ago, but actually lower than May. Next. Government. It is seen as failing to address the crisis. This is a perhaps bit of a overhang from the past years, but getting people vaccinated, big difference, R's and D's. More or less, government is seen as not trusted on that. And also particularly important, reliable source of information. Key point, not preparing for an eventual recovery and how we get back to normal. So again, government, thumbs down, still. Next. Business. Business is getting higher marks for PPE and safety measures and a safe return to work. As for planning for an eventual recovery, I urge all of you in business to be envisaging how are we going to get back to work? You better talk to your employees and not impose on them. Being a reliable source of information, disappointing. We can do better. We need to do better. We have to fill an information void. And the lowest mark is for fair compensation for workers who have been affected during the pandemic. It is seen as business being sort of classic capitalists, paying only what they must. Next. Brands, very important. You'll recall that there was a peak for brands in May when we actually surveyed at the peak of the crisis. So 15 to 17 point drop about the idea that brands are responding quickly and more effectively than government. A 17-point drop about the impact on likelihood to buy. But still, any brand person would tell you a 44% level is very high. This is sort of the new normal that we observe. We don't think this is going to go down further. So in short, pay attention as a brand. You're still critical. Next. Here's the biggest story. My employer is the most credible institution. Taking care of workers, not pressuring people to return too quickly, preparing for a recovery, being a good source of information. Trust is local, big expectations on your shoulders to be the adults in the room. Next. Okay, the media. This is a very sad story. From May, a 20-point drop in the reliability of mainstream media as a source of high quality information about the virus. Politicized, biased, jumping to the tune of Twitter, no good. So in fact, it is a almost dispersion of authority to my doc. That's a huge jump. So trust is local. CDC, much less drop than the news. and also local government. So in fact, I'm getting it from multiple sources, not just the newspapers or TV. Next. Lisa, to you.
About the vaccine. Next slide. Regardless of who is trusted, doctors, scientists are most trusted for vaccine information, and particularly my doctor and scientists writ large. Next slide. That said, regardless of who's providing that information, more than 1 in 3 feel that they lack access to vaccine information. See how it is particularly acute among Latinx and among 18 to 34-year-old as a population. Next slide. The racial and ethnic disparities are real. You've heard everyone talk about them before. This data supports it. They are real. First, among the 42% of all Americans who qualify for and want a vaccine, 71% have been able to get one, while 29% of those who are eligible and want a vaccine say they have not been able to get an appointment. As you can see again, the vaccination rate is lower and the lack of access is greater for communities of color. If you look in this area here. Next slide. Partisanship, political partisanship, gender, and age seem to affect vaccine confidence as well. Women and younger Americans, 18 to 34 in this case, as well as 35 to 54, and Trump voters are less confident in the vaccine. Of note, 77% over here of Americans 55 and older agree with the statement, the COVID-19 vaccine currently available are safe and effective for people like me. Next slide. The role for business, as Richard noted, is significant and I think exciting. Next slide. Employers are most trusted on the pandemic response. Employers, 59% of the US general population agree. My employer is doing well on meeting my overall expectation for how they should be responding. And look at this in comparison to government, only 35. The national government is doing well on meeting only 35 as opposed to almost 60% for my employer. Next slide. Bipartisan approval of the employer pandemic. We saw this in the research that we released earlier this year, that there is some common ground. And in a rare show of alignment, both Trump and Biden voters say, my employer is doing well on meeting my expectations. Nominal difference between the two, 58 and 59. But what do employees want in terms of information? They want information to be trustworthy, but they need it regularly, so weekly or more. So 81% of the US general population feels very strongly, and that's because I trust my employer. I expect to get information from them, and I want it more. Again, look at these numbers for Black and Latinx, significant 85 and 90. And then even for Trump and Biden voters, 77 and 85. Again, this alignment that we don't see anyplace else. Next. And regarding vaccination mandates, employee sentiment is abundantly clear. 69% say they believe that we should decide for ourselves when and if we should be vaccinated. Only 21% say that vaccines should be mandated. Next. Richard talked about this, and employers should avoid imposing a return to the workplace mandate. 60%, employers should not force employees to return to the workforce. Again, look at the numbers here. Pretty steady among all demographics. Black people feeling more strongly than others. It's pretty even among men and women, consistent regardless of age, but a little higher with 18 to 34-year-olds. Minimal disagreement from a geography standpoint. However, a stark variance between Biden and Trump voters, 48 for Trump voters, 68 for Biden. Next. So what do you do with this? It's a lot of data, it's a lot of information, and our recommendations are as follows. Recognize that Americans continue to fear for their safety and are not yet ready to return to normal. We watch the news, I don't know that we are necessarily led to that conclusion, but recognize that people are still very afraid and the normal is a ways off. Embrace bipartisan trust of my employer to build confidence in the vaccine across communities, a rare opportunity where you have people who are divided on everything else who believe and trust their employer. Take advantage of that. Communicate trustworthy information always. Richard uses this term about it being hygienic. So make sure that your information is clean, because people are, they rely on it and they trust it, but it's the frequency of information, and it should be weekly, if not more often. Give employees a voice in reimagining the workplace. We have a team within Edelman where we are looking at, there were some silver linings in the way we learned to work as a result of the pandemic, and employees will have a say in what that new workplace looks like. And lastly, and always for business, partner with government and other institutions to provide equitable and effective solutions. Dr. Nabarro, thank you again for joining us.
Yeah, but we know that we give.
What is your reaction to what we've shared?
Well, thank you very much indeed, Lisa, and thank you, Richard. It's really very, very important indeed, this latest trust barometer. I thought it would be most useful for all of you, seeing as you've got to know me really over the last 14 months, if I just shared with you my expectations about the pandemic over the next 9 months. First of all, I'm expecting the pandemic to continue causing major suffering around the world, with spikes of disease coming up quite locally, swirling infections when you've got a lot of spikes, and then when they all come together, you get surging outbreaks with full hospitals and, unfortunately, overflowing demands on mortuaries. Poorer people everywhere will continue to be more exposed, less able to access care, and marginalized despite their obvious greater need. Thirdly, the virus is constantly evolving. New variants emerge all the time. Some of these are more infectious, some of them give nastier disease, and a few of them will be able to beat the protection offered by the vaccine. And this is inevitable. Fourthly, the new vaccines prevent severe illness and death, but they are less good at actually controlling the pandemic unless immunization rates are very high and the vaccines are kept up to date. Otherwise, it is inevitable that the vaccines will be beaten sooner or later by new variants. All over the world, point 5, there has been a real effort to reduce the level of the disease. The public everywhere understands that personal behavior, including physical distancing and mask wearing, hygiene, isolation when sick, and similar practices reduce the risk of infection. On the other hand, movements, gatherings, being all close together greatly increases the risk of disease. We just have to study the epidemic curves from around the world. Right now, there's been quite a lot of care to try to reduce spread in many different parts of the world. But it's clear from a mix of sources that that's going to be no longer the case, particularly in Europe in the coming weeks. There will be a big spike in cases. And lastly, because this virus hasn't gone away, we have to organize to hold it back. And fear is quite justified. So what's the implications of all this and how does it relate to your trust barometer? 1, the pandemic requires fair and just responses. We must prioritize people who are most in need. They must be compensated for their isolation. They must be supported through their lost employment. And those who are most likely to be left behind must be looked after. Those who are trusted will be those who demonstrate fairness and justice. Number two, the world needs global surveillance of what's happening with this virus, and in particular, picking up on variants. All businesses everywhere should be advocating for a really first-class global surveillance effort. Number three, the response to this virus is best done by people. The virus is the enemy, people are the solution. And people need to be respected for their contributions and supported by local health systems and by community health services at county level. Businesses can play an incredibly valuable go-between role, helping to ensure that what local public health says is done by the people. That's why, one of the reasons why businesses are trusted. Number four, got to make sure that whatever ways of diagnosing or treating or handling this disease are adopted, they've got to be accessible to and valued by people who are poor. Businesses can help by showing that they're not simply conspiring with the wealthy to get shortcuts to vaccines or hospital beds, but that they're actually looking after the whole community. Number five, I call it one fair world. Poor people all over the world realize that the way this pandemic is being handled is not generally in their interests. They look at what's happening to vaccines. They know that all the world needs access to a vaccine. They know that thousands of health workers all over the world have died because they're exposed. And poor people know, because many poor people are working in the health sector, that as long as there is inequity on vaccine access, there is no way that poor people are going to be properly served. Whether it applies inside the United States or across the Western Hemisphere or throughout the world, there is only one way to deal with a scarce life-saving resource. Of course, you give it to the people who need it the most, not to the people who can pay the most. That's where business can really show that it matters, by lobbying government leaders and by having a company policy that says we are in favor of equity. Let the people who need services and who need interventions the most be the first to benefit. That is, I believe, one of the reasons why businesses are getting better trust, because they support the people who need services the most. And I think there's a perception that a lot of the rest of us are skewed to actually be biased in favor of those who have wealth, power, and resources. Thank you.
Dr. Nabarro, I must say that your assessment feels a little bit more sober, if not somber, than President Biden's from last night. I imagine you heard what he had to say, and I wonder what your reaction is to the plans that he laid out by the administration and the common sense that is being perpetuated that we will be back to normal by this summer.
Thank you very much indeed, Lisa. I mean, the difficulty facing all elected politicians right now is that they are expected to be able to come out with good news that sounds good on the airwaves and in social media. And that applies whoever you are as president. I am simply telling you my expectations based on really careful study of what is happening right now and what has been happening, the trends over the last 2 months. I'm also basing it on a global study and not just a study in the US. I don't expect things to be, inverted commas, back to normal, close inverted commas, by July the 4th. I hope they are, and I hope I can be proved wrong. But my expectation is that this virus is going to go on causing trouble in the US as well as in the whole world well into 2022. But I believe we can, as societies, work out how to live with it. And we've got very good experience of what needs to be done from many states in the US, fabulously. We can work out how to live with it, and we can get on with our lives despite the fact that the virus is still here. So perhaps if Mr. Biden hadn't been talking for the media, he might have given a more sober assessment. It's very, very difficult right now giving an interview because journalists expect you to come out with optimistic tones. And that's one of the reasons why I am telling you what I really think today. I think if I had a camera stuck in front of me and I was going on CNN or the BBC, I would probably not have spoken as I do. It's really difficult right now to communicate what you expect is going to happen because you're sometimes accused of being a killjoy.
Right, right. I think what we have all appreciated throughout your engagement and counsel is your willingness to speak your truth, and that is rooted in science. As you were talking, I'm reminded of the cover of our research, and it says America in Trauma. This has been a traumatic experience for us, and based on what you're saying, once we recover, there will probably still be some PTSD. So this is really a question for you and Richard. How do you see the impact of trauma playing out for us as individuals and for us as consumers, as employees, and from the business community?
So David, I'll start. I think that we have to make sure that we have a logical and easily understandable and transparent path back to normal. And we shouldn't jerk back to normal for July 4th. I think it's baby steps, and we should take capacity in restaurants from 25% to 50%, not to 100. And I think it's a more logical, normal. I mean, again, you saw the statistics on only 33% of people want to go into restaurants and sit inside. I was on a phone call with Andrew Yang, who's running for mayor of New York. And he said, in order to get people back on the subways, by the way, subways are running at 30% capacity in New York. Maybe over Memorial Day, we have all free subway access. And so that people start to try again to get around the city that way, as opposed to bikes or cars. These small steps by business, though, have to be met with, okay, so here's my health card on my phone, and it proves that in fact I am vaccinated, or to insist on masking and distancing and less capacity in restaurants. We have to do this with government and not just do it in Wild West kind of manner. So that's my, David, to you.
Thank you. If I was living in the United States, I would be traumatized by the way in which the nation's health has been handled by those with responsibility since we first realized that some big mess was happening. It is massively traumatic. Numbers who died and the suffering that their families have faced, plus the horror of long COVID affecting hundreds of thousands of Americans, and the apparent willingness of some leadership groups to treat this as though it is a trivial matter, I think is massively traumatizing, especially for people who do not feel well served by government anyway, and who perceive that their lives are seen by decision makers to be less valuable than others. And so let's just take it that America and American society, particularly poorer people in the US, are feeling traumatized by a year of non-stop suffering public discrimination. Number one, everybody's got to level with those who've been traumatized, and not with crocodile tears, but with some real effort at empathy. Number two, be careful about things like free subway access, or like happened in the UK, free meals to try to get people to go to restaurants. And the reality is that the reason why folk are not getting into subway cars is a perfectly logical and explicable concern about this virus, which has not gone away. And it is extremely important that decision makers actually level with their people who are scared because they know people who've died or people who've been sick, and don't try to deceive them. The reason why people are not using the subway, the reason why people do not flock to restaurants always when they open, is because they're still nervous about this virus and what it might do. I agree with you, Richard. Baby steps together, and a willingness to go back if something goes wrong. Honesty, clarity, transparency, not about dates, but about data. Yeah, this is very important.
Dr. Nabarro, another question that's come in for you related is, understanding this virus has been hard to predict. Do you think COVID may become an issue similar to seasonal influenza, where vaccination is required each year to match the dominant strain that's circulating?
Thank you very much. Yes, I do believe that we will need to have regular boosters of vaccine in order to help people maintain an immunity to the emerging variants. The only difficulty is that COVID, at the moment at least, is not clearly a seasonal infection in the way that flu is. So with flu, we've got quite a nice opportunity that just at the beginning of the flu season, we are offered a new vaccine which represents the best assessment of the variants that will be dominant in the coming flu season. And it's quite nice because it's a periodic thing. Get your flu shot now. We're just coming into the cold months. With COVID, it won't be quite so regular at the beginning, but I think it'll settle down. My big worry is just simply, how will it be possible to make sure that the whole world benefits from the vaccine revolution, which will lead to new vaccines coming available. And these are not simply a privilege for the well-to-do.
Right. The questions that are coming in are interesting because they reflect one of our findings, and that is people want information and they want it frequently and they need it to be detailed. So this is a question for both Richard and Dr. Nabarro. Congregating could result in spikes in other diseases. Is this a concern to you? How should we counsel clients regarding this risk? For Richard and Dr. Nabarro.
Lisa, I didn't get the word. Could you just repeat the word? It sounded like congregating, but I wasn't sure. Sorry.
Yeah, the congregating could result in spikes. I think we know that congregating results in spikes. In other diseases, is this a concern to you as we return to normal?
Absolutely, yes.
And how should we counsel clients regarding this risk?
I mean, there are some massively difficult issues with this virus. One is, if you want to get a spike in disease, you bring people together, especially inside a closed space like a nightclub, and you reduce the ventilation, and they'll get sick. If you want to prevent people from getting sick, you encourage them to keep 2 meters away from each other, and you discourage congregation. And there's no alternative for the time being. And until we are able to come up with a vaccine that will cover all the variants, and we're able to make sure that is available to everybody, we are going to have to be really careful about congregating. in ways that give the virus an opportunity to move around. My only hope is that it'll be quite soon when we will have really reliable, rapid tests that enable people to know within seconds whether or not they've got the disease. And if these rapid tests are inexpensive, then it will be possible to use them as a reasonably good way of minimizing risk when congregation takes place. But we're not there yet. So much money has gone into vaccine development. There's just not been enough money into test development. And that's one of the things I'm working for, is more reliable, rapid tests that enable life to get back to normal.
So Lisa, my response to this is, I think we have to avoid manic behavior, which is moving from trauma to euphoria, and that somehow we're going to have some big event on July 4th in Washington with fireworks and all this other, and John Philip Sousa and the Marine Corps band. And, you know, we need to encourage and in fact discuss openly with business as being in a certain way the donkey that's harder to move along. Not, this is not a political point. It could be the elephant that's harder to move along. I don't care. It's that in terms of risk return, just explain it that if we go backwards and have to go back into lockdown, the cost to the economy and the cost to the brands is massive. So therefore, small steps, and don't have expectations set for consumers that you're not going to be able to meet. So again, if the goal this summer is maximum number of people getting together is 50, 30, whatever the number is, let's tell people now so that they aren't planning big weddings or, you know, bar mitzvahs or whatever else. But set those forward and then let the companies execute and let public health people like Dr. Nabarro tell us what's safe.
It is a question of moderation, because after a lockdown, the natural inclination is to rush back into it. And what you both are saying is we have to ease ourselves back into it, be thoughtful, and work with intention as we are moving forward. This question, Richard, I think will resonate with you because it's part of why we went back into the field. It is very difficult to function in an area where government officials are pushing for a return to normal and actively legislate against businesses' ability to enforce things like the use of masks. It creates a rather hostile environment for those who are still concerned and cautious about the virus. The question, what, if anything, can be done by individuals and or businesses to help in those particular situations?
I would just say, don't leave your employees exposed to taking the heat. That it needs to be a company decision on the front door of the store, and make it evident as to why. And so, as an example, if you're going to do temperature checks or whatever else it is, do it outside, and don't allow the thing to become overheated, and set the expectations in a public way on the web. You know, through notes directly to your customers, frequent customers, and let them spread the news that this is your policy. And if you do have to go against the governor of Texas or whoever it is, it's not a matter of politics. It's a matter of the company's made a decision, and it's not up to me. I'm just implementing. David?
The reason why companies and institutions are asking for mask wearing is to benefit those people. It's not for anybody else. And so the part that I just cannot understand is how a government can forbid mask wearing when the purpose of the mask wearing is to promote good health. And so if I was in a company, I would be hopefully saying masking is advised out of caution on behalf of our customers and our staff. I would all the time stress why it's being done. So I think I'm saying the same as you, Richard.
I would be remiss, given the data that we talked about, and Dr. Nabarro, the passion with which I know both you and Richard feel about this issue of equity and disparity in terms of access to vaccinations for Black people, for Latinx people, in some cases, regardless of their economic circumstances. What was your reaction to the findings? I don't think you were surprised. It's Asian American communities as well. But what is the answer? What can we do to reduce these disparities, to increase access, and to actually also just abuse ourselves of this vaccine hesitancy among communities of color? Because the research indicates it's not hesitancy about the vaccine, it's like, I can't get it.
So Lisa, my answer to this is we have to directly go out and refute that myth. But we also have to have a solution. And so I heard of something in Chicago, a company called Oak Street Health is literally going door to door, old style politics, and knocking on people's doors and saying, look, you live around here. Perhaps you weren't able to get through because you don't have technology to get on the website, or you don't know how, or whatever else it is. We're here to sign you up. It's almost like voter registration. It's very old school, but it's really working. David?
Exactly the same. Make a positive effort to listen actively to those community members, to reach out with an offer that they find to be acceptable, and then to make it available in ways that are not seen as demeaning or damaging, and to do it consistently, to do it openly, and to do it over a decent length of time, because there will be initially a great deal of suspicion of that kind of behavior, and that's why it has to be maintained. That's my suggestion.
I mean, Lisa, one other thing that's become evident is a decline in vaccination for DPT and the usual shots. And I just scribbled down this little note, why don't we have a kids' day for vaccination? Like give parents who have, who have kids, we'll give you a day off, go get them vaccinated. Something like this. So business can play a constructive role here.
Right. And the expectation is that business does that. We are unfortunately at time because we have a number of other questions. Dr. Nabarro, Richard, I'll leave the last words to you.
So David, you go first and I'll close.
Everybody in the Edelman company, just continue doing what you're doing all the time, remembering that behind these numbers are some really disturbing realities. These inequities in access to vaccine within the US and across the world are huge. And they'll be remembered by those who are being left behind, not just for 1 year, but for 5 years, 10 years, 20 years. These kinds of disparities just reinforce the correct perception that in our society, there are those who are able to access what's needed and those who find it super hard. And we need to remember that. And I hope that you can advise your clients that anything they can do to address these disparities will gradually contribute to a return of even greater trust and to a much better world. I'm struggling with this, with vaccine access for the world right now. I've seen thousands of health workers, particularly in poorer countries, have died simply because they're not adequately protected against the virus. They ought to be able to get vaccinated, and they can't. Or if they can get vaccinated, it's proving to be hard to get the vaccine in decent quantities. And that's because our world leaders just can't get it together to have a fair approach. I think if you can talk about fairness and justice in your interactions and get businesses to be champions for fairness and justice, even more than they are already, this could start to mend the world. Because if we go on like this, it'll be, unfortunately, quite disturbing, as those who have missed out or have found it hard to get what they need will be left to rue the unfairness of our societies. So thank you for all you're doing. You are a beacon of light in what's a sometimes rather a bleak environment.
David, thank you. I'll just make a little symbol. This is the pyramid of authority that more or less was how companies were run for years. And the people on the top made the decisions and the people on the bottom worked there or they didn't work there. And here's what's happened. It's flipped upside down. And you saw in this data for the first time evidence that I will not be dictated to about vaccination. 70% of people said, no way. And 60% said, don't tell me when I'm safe to go back to work. Our job in business is to educate, persuade, advocate, and assist them to get the best possible decision for them. And so we really need to take this on as a serious mission over the coming weeks. Compulsion doesn't work. It never works with kids. It never works in society. It somehow is seen as evidence of weakness if we don't insist. False. Weakness is compulsion. Intelligence is actually the basis of human interaction. We need to give people facts and enable them to make the right call. So, Lisa, with that to you.
Leadership is engagement and collaboration. It's when it makes a difference. I would be remiss if also I didn't say to Dr. Nabarro, your passionate and compassionate leadership is inspiring to all of us. Richard, doing this makes all the difference in the world. And I'm sure I speak on behalf of all of us at Edelman. We're proud to do the work that we do. Thank you, everyone. Take care.